What situation would cause somebody to call you in?
Well, if there is a sentinel event, something bad, you can basically say to yourself, this is a happening that happens once and we are okay. Or you can ask, is this happening because there is something in the organization that we are missing? And is basically a condition that may facilitate the recurrence of the same event. So this is a call of the organization themselves. If they feel like they need some outside eyes, someone else coming in and asking the questions, then we can certainly provide the consultation.
And I think it also requires a learning culture and a learning leadership style where they want to always learn and improve rather than assume they're already at the top, because the times keep changing, circumstances keep changing, and we need to be able to be flexible and adaptable and be ready for the next problem that comes our way. And there's always going to be something. And that's part of the training, is that the readiness, because there's always a mishap around the corner. And how do you prevent it or become aware of it and take responsibility for it before it becomes a sentinel event?
We are actually particularly interested in the second most common sentinel event reported by the Joint Commission. The most common one is a fall of the patient. So the patient falls to the ground, he breaks his or her leg, and he has surgery because of it. And that is usually due to the fact that the patient may be waiting to be helped to the toilet at night time, and they decide to go on their own, they trip and they fall. That is the most common sentinel event. Something that should never happen, but is unfortunately happening all the time. The second most common sentinel event is forgetting something, a sponge or an instrument, inside the body of the patient at the end of the surgery. And that is what we are particularly interested in, because I'm a former surgeon and I feel like it is something that should never happen. So if it happens, it tells you that there is something wrong, because it is not possible that a team that is collaborating and aware of what the steps that need to be done can let this happen. And when you examine one of these cases, you can find for your organization what is that needs to be fixed. And if you come from the outside, you can say, you know what, the problem here is that your CEO pays lip service. You know, at the end of the day, he's only interested in the profit and the bottom line. And if you do that, you're going to have this problem, because people feel like then it's more important to finish the surgery quickly to put another case, instead of finish the surgery correctly and spend an extra 5 minutes to check and count the number of sponges.
And
so sometimes the reality of things is actually more than embarrassing. You know, you feel like you need to speak up, and it could be difficult. So you want someone from the outside to say, you know, the problem is obvious. This is the problem. And unless you fix it, it's not going to change. And it's not the last nurse, like Karen was saying before, who made a mistake. It's the surgeon who decided it was not necessary to count because he was confident that he had counted himself.
And as an anesthesiologist in the room, I felt responsible for the patient and whose vital signs and whatnot I'm monitoring, and even for the surgeon, because it's the surgeon's looking at a particular organ and working on that organ in the moment. I am seeing the entire room, because my eye is trained to go look from the vital signs to the patient, to what the surgeon's doing, what are the nurses doing, and making sure that cleanliness isn't broken, that people are being safe, that people are noticing and focused on what's going on. There's not loud talking that's distracting or anything like that. And it's really important to make sure that everyone is on the same page, looking for the safety of the patient in particular, but that will affect themselves as well. And I think that the other reason that we could be called in is sometimes bad cases hit the public news. And that isn't very good for an organization's reputation. And they need to be able to turn around and publicly state, not just an apology, but to be able to publicly state what they're doing to change it so it never happens again. And that usually requires an outside opinion and consultant, because if they had known from the beginning, they would have been doing it right up front.